The city of Hartford had 5 overdose deaths from 7 p.m. last night to around 10 o'clock this morning. That is quite a bit of a spike that we see in regards to the overdose deaths. That's caused a little bit of alarm to the police department as well as the city of Hartford. Furthermore, in regards to the spike in the overdose deaths, we also observed that there were several inconsistencies in regards to a typical pattern of these deaths within the city of Hartford. A specific geographical location within the city, as well as the same gender and race and age demographic. Also, what has been occurring is, as of late, we've noticed several other drugs aside from the typical heroin fentanyl mix that's occurring within the city of Hartford. We've had overdoses with pills, crack cocaine, heroin, and powder cocaine. This is of an immediate alarm to the Hartford Police Department as well as the city of Hartford. We're looking for the public to help out any way they can in regards to getting the word out. This is not just a heroin problem. This is not just an epidemic specifically to heroin. Recreational drugs, designer drugs. We've even located several instances of marijuana that have been laced with fentanyl. With other questions in regards to this, I will refer to Leanne Arroyo from the City of Hartford Health and Human Services.
Good afternoon. As a director of the Department of Health and Human Services for the City of Hartford, we are very concerned about these overdose deaths as well as the rash of overdoses over the weekends of non-fatal overdoses, all of which have been attributed to drugs that are not heroin or opioid related. We are urging anyone who has a family member with substance abuse disorder of any type of drug to please make use of our Community Resources Act, also known as AIDS Connecticut, and the Greater Hartford Harm Reduction Coalition here in the city. They have access to naloxone. We are encouraging all families to access that, as well as anyone who may have substance abuse disorder to access any fentanyl testing strips that are available at both of these agencies. It is critical for us to ensure that our residents have access to this and can make decisions that are best for them. We are working with the Commissioner of the Department of Public Health as well as DEMIS here in the state to bring more naloxone into the community now that this is expanded beyond heroin and opioids, as well as bringing additional fentanyl testing strips as well. So with that, I'd like to invite our Commissioner of Department of Public Health, Renee Coleman-Mitchell, up.
Good afternoon, everyone. As was said, my name is Renee Coleman-Mitchell. I'm the Commissioner for the Department of Public Health. I want to make it very clear that our goal is to support our local health departments and our communities. Secondly, to coordinate efforts in regards to the opioid crisis here in Connecticut. And most importantly, I have to be honest with you, our goal is if you see something, say something. Without our community, we really can't make that much of an inroad. We need all of us to come together on the ground to make the difference. And with that said, I'd like to lastly introduce our Deputy Commissioner from the Department of Mental Health and Addiction Services, as we have always worked very closely with them in coordinating efforts for our local communities.
Thank you, Commissioner. Good afternoon. My name is Nancy Navarrete, and I am the Deputy Commissioner of the Department of Mental Health and Addiction Services. We are here as a department to provide support in any way we can to our community partners here in Hartford. Our mobile crisis team in Hartford is aware of the situation and is equipped with naloxone. Our regional partners also have naloxone available for distribution, and should anyone need some, we can loop in those partners. It is important to understand that fentanyl is not just present in heroin, but can be found in other illicit drugs, including cocaine and drugs that come in pill form. Even small amounts of fentanyl can be deadly. If you or a loved one is actively using illicit drugs, it's important to have naloxone on hand in the event of an opioid overdose. Having naloxone on hand could be a matter of life and death. Most pharmacies have pharmacists who can prescribe and dispense this life-saving medication. Recovery is possible. That's the message that DEMIS wants to promote, and help is available to you. If you or a loved one is struggling with addiction, please call 1-800-563-4086 to be connected to addiction treatment services, or go to www.liveloud.org. Thank you very much.
Thank you, Commissioner. What I'd like to add is in regards to the investigations that occur within overdose deaths in the city of Hartford. So the Major Crimes Division works with our Vice and Narcotics Unit to track these the drugs, the bags, the packaging to the drug dealers and where they come from. With that being said, we are asking the community and the public, please, if someone you love, a friend, anybody overdoses on these drugs, we need the packaging. We need the contraband along with that. We assure you, the Hartford Police Department, the City of Hartford will assure you that you will not be arrested. If we respond to an overdose call, if our detectives respond to an overdose call, we will not arrest any individual who is in possession of narcotics or any contraband or packaging associated with the overdose deaths. So that is a tremendous asset in regards to the investigation, and that is evidence that we need to ensure that this won't go any further, and hopefully that can save for future lives. So we're asking the City of Hartford residents and beyond the state of Connecticut. It's not just an epidemic here. It's not just a problem here in the City of Hartford, obviously. And we're looking for everything we can to assist us for the community. We'll be taking any questions at this time.
Can you just clarify in terms of those 5 deaths, what are they being linked to? What drugs?
Several different. We got reports. One was smoking crack cocaine. We had some paraphernalia in regards to needles and packaging of heroin. And we do have crack cocaine and public cocaine as well. So that's why we're all here today, because typically the stereotype is fentanyl only comes in heroin form, and this is not the case. In this particular last 5 that occurred in the past 15 hours or so, 18 hours now, varying amounts, different amounts.
So again, this is heroin, opiates, but not in typical prescription pill form that like we think about. Is that what you're saying?
Well, it's coming in, typically the fentanyl is mixed with heroin. Now we're seeing it in pill form. We're also seeing it laced in crack cocaine, as well as powder cocaine, and we're even seeing marijuana that's laced with fentanyl.
And was fentanyl involved in all 5 of these?
We're going to have to wait for the toxicology reports for that. That typically takes about 2 to 3 months.
And you mentioned that these all stemmed from a similar geographical area, and the victims were similar age, gender, and ethnicity as well. Would you mind shedding a little light on that?
These were all males, aged from 50 to 61, which is higher than what we typically see in regards to overdoses. They were all in an area specific to the Asylum Hill neighborhood. Interestingly enough, last night our Vice and Narcotics Division executed a search and seizure warrant on Huntington Street. They recovered 1,000 bags of heroin and 70 grams of crack cocaine. The heroin did have a positive reaction to fentanyl presence. The crack cocaine is currently being tested to see if that, in fact, had any fentanyl in it as well.
Has there also just been a general spike in overdoses in the last few days in the city?
It's been consistent, although we have a rise in previous years. So far this year, this marks our latest overdose death marks the 39th overdose in the city of Hartford alone. On June 4th last year, we were at 22. So we're 17 more this year than we were last year. 5 in a short period of time has not been seen in several years.
And was it just the magnitude of 5 in 15 hours that made you want to appeal to the public to get them to come forward? Is this another kind of way to deal with this problem?
Well, a couple of things. So 1, this is always a concern. 2, obviously 5 within such a short period of time. And 3, that we're not seeing it just in heroin form. So, people that are using designer drugs, prescription drugs, recreational drugs, that's the message we really want to try to get across today. It's not just heroin that has fentanyl presence, it's other drugs as well.
Obviously, it's impossible to know 100% in these cases, but do you think in many of these cases where people are ingesting stuff that's fentanyl that's mixed with other things that they even know what they're taking?
We don't know that. We talked to the survivors. There's been hundreds of Narcan deployments in the city of Hartford alone. There's been 9, I believe, since Saturday evening that have been revived, thankfully. So, yeah, we try to maintain those records and whatnot, and we keep doing what we can and working with our partners.
Can you tell us more about what you said about it being found in marijuana?
Just laced. Just mixed in it with the marijuana, and there'll be some presence of fentanyl in there.
But is that like one case? That just sounds very unusual. So I don't think we've heard of that happening before. What part of Hartford, or was anybody injured? injured?
I don't
in
have the
that?
specifics in regards to that, but we don't just look at the trends that are occurring in Hartford, we look at the entire state and beyond. The pill form fentanyl is typically something that we see more in the south, down in Florida, and the Carolinas, and you can see it kind of moving up this way. So this is something that we haven't seen in the past. We've had 2 overdose deaths with pills just several weeks ago, double overdose. The third surviving victim thankfully told us that they each ingested a pill prior to having the medical episode. So that's something that we haven't seen in memory. So we're also getting information that it's also mixed in with the heroin and cocaine. And when we do test the narcotics or the controlled substances, we are finding that presence of fentanyl in these drugs.
Has any packaging been found that links all these together?
We have. We do often, and sometimes we don't. And I'm glad you asked. A lot of times, as I mentioned earlier, people are afraid when they call 911 and say, hey, there's an overdose or a medical episode occurring here. They will throw away or flush the remnants or the packaging. They're afraid that they're going to get arrested. That's not the case. As I said before, we will not arrest anybody for possession of the narcotics or possession of the contraband packaging or whatnot. We need the evidence. Our detectives are crime scene leading, our major crimes detectives, or licensed narcotics detectives. They track that packaging, and we do whatever we can for basically public information and let everybody know in regards to what to avoid.
And just following up, is there packaging in these cases? Like, does it seem to be that they're all linked together?
The detectives are actually, obviously, this is still the these last 5. The double, obviously, was the same batch of narcotics. I'm not sure about the other ones, if they match up or not, but that's something that, during the course of the investigation, that's something that they look at. So, for instance, the seizure that occurred last night on Huntington Street, they're going to look at those bags, and they're going to compare them to any overdose deaths that occurred in the city of Hartford for basically overdoses and overdose deaths.
We hear a lot about Park Street being an epicenter of the epidemic in Hartford, and Hartford being the center of the epidemic in Connecticut. Can you speak to whether that still seems to be the case, even though you're saying these particular deaths were in different areas of the city?
I don't have any information that would echoes what you said in regards to Park Street being like a hot zone. There is a challenge area in regards to drug and narcotic activity. That is true. But
You're saying Park Street is not a hot zone?
oh, it is. Certainly it is a challenge area, but in regards to it being the only challenge area in the city,
No, I didn't say that. I said the epicenter.
I wouldn't even call it the epicenter. I think there's areas all over the city that are challenged that we do focus on, Park Street being one of them. So we do allocate our resources in regards to our narcotics division, our street crime units. We go where the drugs are. We don't concentrate on specific neighborhood or specific districts.
Are there any additional resources out in different parts of the community right now in response to this particular spike?
Well, we do have our vice and narcotics division that are obviously aware of it. With the recovery of 1,000 bags yesterday, we're going to talk to informants, deal with people that they've arrested, and try to understand where these narcotics have gone, where they're coming from, where they're going. We also have DEA that works with us, as well as ATF, so we do have a lot of partners with other police agencies, not just the Hartford Police Department, as well as obviously our partners here today, to try to do with this the best way we can.
This might be a question for someone else, but are there any additional harm reduction resources going out right now?
So we reached out to our partners today, had a conversation with them prior to this, and they will be expanding services if necessary. They have asked, again, for more fentanyl testing strips to broaden their reach, because they've used those for prescribing for individuals who have said that they've used opioids or heroin in the past. But yes, they are willing and able to expand services, and once we get them more resources in terms of the naloxone and the fentanyl testing strips, we will have more hours and ability to do them. But they have all said that they're willing to do more, and just waiting for the to go ahead from us, and that's what we'll be doing for Jackson.
Thank you, everybody.